Mpox, monkeypox, is a communicable disease, viral disease. Look at this picture, shows that skin rash and virus. Detail going on. Introduction. Mpox, formerly known as monkeypox, is a viral zoonotic disease, meaning it spreads from animals to humans. It is caused by the monkeypox virus, part of the orthopox virus genus. Which also includes the variola virus, responsible for smallpox. Mpox has been primarily reported in Central and West Africa, but has recently seen outbreaks in other parts of the world. Definition. Mpox, formerly known as monkeypox, is a viral zoonotic disease caused by monkeypox virus, characterized by fever, rash, and swollen lymph nodes. It spreads through contact with infected animals, humans, or contaminated materials. Types. Mpox has two distinct glades or types. 1. West African glade, generally cause a less severe illness with low fatality rate. 2. Central African Congo Basin clade, known for more severe illness and higher fatality rate. Causes. Mpox is caused by the monkeypox virus, which is transmitted through direct contact with the infected animal, human, contaminated materials. It enters the body through broken skin, the respiratory tract, or mucous membranes, eyes, nose, mouth. Transmission. 1. Animal to human, by handling infected animals, example rodents, monkeys, eating undercooked meat, or bites. 2. Human to human, close contact with respiratory secretion, skin lesions, or object contaminated by an infected person, example bedding, clothing, etc. Risk factors. 1. Close contact, those who come into contact with an infected person or animal. 2. Travel, people who travel to endemic areas in Central and West Africa. 3. Occupation, healthcare workers or laboratory personnel handling orthopox viruses are at high risk. 4. Compromised immunity, people with weakened immune system are at greater risk for severe disease. Complications: 1. Secondary infections, bacterial infections at the lesion sites. 2. Bronchopneumonia. 3. Sepsis. 4. Encephalitis. 5. Corneal infection leading to vision loss. 6. Severe cases of Mpox can result in permanent skin scarring, disfigurement, or death, especially with the Central African clade. Pathophysiology: the monkeypox virus enters the body and begins replicating at the site of infection, which could be skin, respiratory tract, or mucous membranes. The virus then spreads to nearby lymph nodes, leading to viremia. The results in the typical fever, systemic symptoms followed by a rash as the virus infects the skin. The incubation period ranges from 5 to 21 days. The pathophysiology of Mpox involves a series of stages that the virus follows from the point of entry into the body to the development of symptoms. Here is step-by-step breakdown of the process. One, entry into host, route of infection, incubation period. 2. Viral replication at entry site, initial viral replication, local inflammation. 3. Spread to lymphatic system, lymphatic spread, lymphadenopathy. 4. Viremia, virus in the bloodstream, systemic spread via bloodstream. Dissemination. High immunoresponse and prodromal symptom. Immunoresponse activation, prodromal symptoms such as fever, headache, fatigue, muscle ache, back pain, chills, lymphadenopathy. 6. Rash development and skin involvement, viral spread to skin, lesion formation through several stages. A. Maculous, flat and red spot on the skin. B. Papulous, elevated lesion. C. Vesiculous, fluid-filled lesions. D. Pustulous, lesion filled with pus. E. Crusting or scapping. Eventually, the pustulous scab over and heal. Location: the rash often starts on the face. 7. Resolution or complication: healing of lesions, complications including pneumonia, viral or secondary bacterial, encephalitis, brain inflammation, sepsis in severe cases where the infection spread through the blood, corneal infection which can lead to vision loss. 8. Immunity, long-term immunity. Once the virus has been cleared, the body typically develops. The step-by-step pathophysiology process reflects how the Mpox virus enters the body, replicates, spreads, and causes the symptoms seen in infected individuals. Signs and symptoms. Symptoms of Mpox typically last 2 to 4 weeks and are similar to smallpox, but generally less severe. 1. Prodromal phase. 1. Fever, 2. Headache, 3. Muscle ache, 4. Back pain, 5. Swollen lymph nodes, 6. Chills and excursion. 2. Rash. 1. Appears 1 to 3 days after the fever. 2. Starts on the face and spread to other parts of the body. 3. Lessens, progresses through maculus, papillus, vesicles, pustulus, and crusting phases. Medical diagnosis. It is based on clinical presentation, travel history, and potential exposure to infected animals or individuals. It is confirmed by laboratory test, primarily 1. PCR, polymerase chain reaction, to detect viral DNA in lesion samples. 2. Serological testing for antibodies against the virus. Nursing diagnosis. 1. Acute pain related to rash and lesions. 2. Risk for infection related to open skin lesions. 3. Impaired skin integrity related to maculopapular lesions and pustules. 3. Deficient knowledge regarding infections, transmission and preventive measures. 4. Social isolation related to the infectious nature of the disease. Disease management. Managing symptoms, preventing transmission, and supporting the patient's overall health. Key aspects include 1. Isolation. Infected individuals should be isolated to prevent the spread. 2. Skin care. Proper wound care and keeping lesions clean to prevent secondary infections. 3. Hydration and nutrition. Ensuring the patient remains hydrated and gets adequate nutrition. 4. Pain management using analgesics for fever and discomfort. 5. Emotional support, addressing the emotional impact of being isolated and stigmatized due to the disease. Treatment. Currently there is no specific antiviral treatment for Mpox, but supportive care is essential. 1. Antivirals. Tecovirimat, Pseudofovir, Brincidofovir have been used in severe cases. 2. Vaccination. The smallpox vaccine provides cross protection due to the genetic similarities between the virus. Post-exposure vaccination may prevent or lessen the severity of illness. 3. Immunoglobulins. Vaccine immunoglobulin may be considered for patients with severe immunocompromise. Psychosocial medicine. Patients with Mpox may experience anxiety, depression and stigma, particularly due to the visible nature of the skin lesions. Psychosocial care involves 1. Counseling, address emotional distress and provide psychological support. 2. Education, informing the patients and their family about the nature of the disease, the need for isolation and ways to prevent transmission. 3. Social support, helping patients maintain connections with family and friends, especially during isolation periods, can prevent feelings of loneliness and abandonment. Prevention. Prevention strategies include 1. Vaccination. People at high risk, example healthcare workers, laboratory staff, should receive the smallpox vaccine for protection. To avoid contact, limiting interaction with infected animals or people, especially in endemic regions. 3. Hygiene. Regular hand wash and use of personal protective equipment in healthcare setting. 4. Safe blood handling. Properly cooking meat, particularly in area where the virus is common in animal reservoirs. 5. Education, raising awareness about transmission risk and preventive practices, especially in endemic regions. In conclusion, Mpox is a re-emerging viral infection with significant implications for global public health. While it shares similarities with smallpox, it is less severe and generally has lower mortality. Effective management including early diagnosis, supportive care, antiviral therapy for severe cases, and vaccination for high risk individuals. The psychological and social impact of the disease is significant, highlighting the importance of psychosocial support alongside clinical treatment. Preventive strategies remains key, especially as global travel increases and Mpox outbreaks occur beyond traditionally endemic areas. Thank you. Have a nice day.